for Radiothon 2018, 102.5 DVE. My next two guests are here in front of me, and they're both really beautiful ladies. This is so cool. Would you oh, by the way, just let me update you. 412-692-8900. As you know, we need 20 rock stars to meet our goal before the electric lunch. We have 8. So we are past the halfway point of the hour, and we're not past the halfway point of meeting our goal. So if you want to interrupt us, as always, we won't think you're rude. We'll think that you're great. 412-692-8900. That's try to become a platinum rock star, $20 a month, or do 10. If you just want to be just a full-on regular rock star, that's cool too. Just give a buzz, 412-692-8900. So everybody, please welcome Antonela. Hi, Antonela.
Hi.
How are you?
Good, how are you?
Good. And Antonela has been kind of in and out of hospital since she was a little tiny kid, right?
Yes.
Okay. So we'll leave it at that for a minute because you have been helped by Stacey. Hi, Stacey.
Hi there.
Stacey is a pharmacist, and a special kind of pharmacist with Chartwell services. So what kind of pharmacist are you, Stacey?
I am a pharmacist who works with IV infusion. So
Okay.
what that means
So yeah, because
is,
I kept hearing that Chartwell is all about infusion and stuff.
Yes.
Right. So what is that?
We provide antibiotics through an IV catheter for children and for adults, so that they can be in the home more and not in the hospital as much.
Okay. So Antonella, and we'll get into all your adventures in a moment, but that means that you have to have a port in you. Okay. And then Stacey is the person who would provide your antibiotics or whatever you would need from
Yes.
Chartwell. Okay. So here's the deal with Antonella and Stacey. How long have you been involved with a relationship with Stacey? How old were you when it started? Do you remember?
She started being my pharmacist at the age of 3-ish. So we've
3.
been,
Okay. And what was it that made you sick when you were a little kid?
I had a volvulus of my small bowel that
Okay.
required me to get an intestinal transplant.
Okay, so you needed a transplant. When did that happen?
When I was 1.5 years old.
My gosh.
Yeah.
So you had that first, and then Stacey entered the picture
Yes.
afterwards because then you needed to be infection-free and all of that, right?
Yes.
Okay. The thing about Antonella and Stacey is, so Antonella, how old are you now?
I'm 22.
You're 22, and this started when you were 3.
Yeah.
These two have never met. This is the first they've ever seen each other. Ever. How crazy is that? That is so wild. So what do you think of each other? Or do you look anything like you thought you would? No? Okay, so Antonella, what did you think Stacey, your pharmacist from Chartwell, was going to look like?
I thought she would have brown hair and she would be short.
She'd be short. All right, now I'm going to get really catty. Did you think she was going to be a big lady, a medium-sized lady, or a skinny lady? Be honest. Oh, you did? You thought
Yeah.
she'd be a slim woman. Okay.
Yeah.
So, because people say to me, because they don't know what I look like on the radio, they go, I thought you'd be so big and fat, and then you'd be eating donuts. And I'm like, what? I think they just think that if you have a nice voice for radio, you must be a larger person. I don't know what people think. So, Stacey, what did you think Antonella was going to look like?
She actually is exactly who I thought she would look like.
Really?
Yes, yes.
Well, that's fantastic.
Yeah,
She's
I
gorgeous.
have had some help. Yeah, she's beautiful.
Thank you.
If you guys go on Facebook Live, or you go on now, you're going to see what these two ladies look like, and they're both beautiful. So you had your transplant long time ago, and now was it a smooth ride, or did you have bumps in the road, or what went on?
I got my first transplant in 2005, and after 6 months, I went into severe rejection. So the transplant had to be removed, and I was placed back on the waiting list, which I'm currently still waiting for one.
No kidding. No kidding. Wow. So in the meantime, it's Stacey that's sort of helping you. You look super healthy.
Thank you.
And that's because so many folks are taking care of you, and I'm sure that you take care of yourself. Really. You're absolutely gorgeous.
Thank you.
So you're waiting for another intestinal transplant.
Yes.
Wow. Speak to that, too. I mean, I just, for the first time, I'm real embarrassed about this, but I'm going to admit that I didn't become an organ donor until a month ago. I put it on my license plate. I was chicken. What am I chicken about? Why do I need these things, right?
Yeah.
Why do I need these things? So I hope to help a lot of people when the time comes. So you're waiting for a perfect match.
Yes.
Okay. So what does that entail for you on a day-to-day basis because you don't have a new intestine, a part of an intestine yet?
The first step is my cell phone's always by my side because I never know if the doctors are going to call me or anything about what's going to happen.
Right.
Second off, it is Stacey that does all my TPN and all my antibiotics and my IV fluids that I get on a daily basis for 8 hours.
So Stacey, you have to do this 8 hours a day,
Yes.
every day, and
Yes.
so finally, God willing, you're going to get an intestine.
Yes.
Wow, Stacey, what's that like with your patients, your clients? What does that involve?
We call them every week just to check in with them to make sure that they're feeling okay. We look at their lab work every week, and then we contact, Antonela's physician at Children's Hospital and see if they want to make any changes, and then we get the orders and mix her TPN and her fluids and her
What is
antibiotics.
a TPN? Could you explain?
TPN is an IV. It's pretty much IV nutrition.
Okay.
So when you can't absorb food normally through your intestines, or if you don't have intestines, you can get IV TPN, which has all the nutrients that you need for the
Okay.
day.
So Antonella, do you not eat regular food?
I do.
You do eat regular food?
Yeah.
Okay. But you can't process it like I can.
Yeah.
So you don't get the nourishment. You can eat it, but it doesn't help you.
Yes.
It doesn't help you subsist. You would waste away and die,
Yes.
pretty much. Now, are you in pain? What sort of discomforts do you feel, if any?
To me, this is normal, so I don't know.
Okay, that's right. This has been your life,
Yeah.
and you're 22.
Yes.
And I hear you're a nursing student at Duquesne.
I am.
Wow, that's so great.
Thank you.
How close are you to graduating?
I'll graduate in May.
Wow. Okay.
Yeah.
This happens a lot with people who've spent their lives in the hospital. They give back and they want to be part of it. So, Chartwell, this is your first year being part of Radiothon. I hear that you guys were on the air with the DVE morning show today.
Yes.
And now I get to meet you also. But what's so funny is I met you guys on the same day you met each other, which is insane. Being that you're involved with each other 8 hours a day, which is just crazy. So I hope the next time we see you, maybe you can come back next year and maybe you will have been here and you will get your intestine.
Thank you.
So we'll pray for you.
Thank
you for all you do for the other kids. And you, Stacey. First time I've ever met a Chartwell pharmacist, so it's a pleasure to meet you as well.
so
And
nice to
thank
meet
you
you.
for being
Thank
part
you.
of Radiothon. Can we hear it for Antonela and Stacey right now? Now that they can be friends like in 3 dimensions. Hey, you're gorgeous, girl, and I can't wait.
Thank
You know,
you.
I might get sick and you might take care of me, and that'd be pretty cool.
Okay.
Okay, will do?
Sounds good.
All right, good. All right, 412-692-8900. We got to get to 20 before the electric lunch. We're at 8 still. I know because it was a cool interview, but now we got to get to work. Let's get a song on here, and let's get the phones ringing. Phone bag, 412-692-8900. Stacey, Antonella, thank you guys so much. Live from Children's Hospital, Radiothon 102.5 DVE.